Hello everyone. I have towels set up, I have a different microphone, and I did do a little test of the audio and it still sounds a little tinny to me. So my apologies, we're a work in progress. I will figure it out. I was on a conference call yesterday when I was giving a presentation and I kept getting complaints about background noise and echoes. And so I decided that this was probably also why my videos for this YouTube channel weren't turning out as far as audio went. So I decided, I was like, towels up, blankets up, try and get some noise blocking, maybe try and reduce the echo, but still not 100% satisfied. So that's obviously a work in progress. I am 18 weeks and 6 days right now. So tomorrow we change over to 19 weeks, which is super exciting because when I was pregnant with Oliver, we only made it to about 38 weeks and some days. So that means that if this pregnancy is like my pregnancy with Oliver, likely this means that I'm halfway through my pregnancy. But that doesn't mean anything. I could go all the way to, 42 weeks. And so then we wouldn't be done, or we wouldn't be halfway through for another couple of weeks, but still exciting nonetheless. So this is my 18-week video update, and I will show a little bit of a belly in this video. I know I said I was going to in other videos, and I had some comments like, oh, let's see a belly so that we can, see the progress. And I keep forgetting, so I'm really going to try and remember to do that at the end of the video. But I do want to caveat that this is more like a 19-week belly than an 18-week belly. And I'm a very tall lady, so if you see me, like you see my belly and you're like, oh, that's not very much of a belly, it's just because of the way I carry my babies. They tend to kind of stretch out really long, and I'm quite long myself. So my in-laws are like, you don't even look pregnant at all. My husband is like, you look way more pregnant than you did with Oliver. And for myself, it really depends on the day. Like some days I feel like I am so very pregnant, and then other days I'm like, oh, I'm as thin as I've ever been. So I guess it just really depends on the day. And I think that that's very true of pregnancy as well, because your hormones will fluctuate and you'll carry more water weight on some days than on other days. And so even when you're in your early pregnancy, you might look like a few months pregnant when you're only, 1 or 2 months pregnant. And that's because you're carrying a lot of water weight and you're actually just bloated because of all the hormones that are going on. It's not actually because of your baby's size at all. It's not until you get into your late second trimester and your third trimester that your body is actually the way it is because of the baby. Well, it is all because of the baby, but the shape is because of the way your baby's sitting and how big your baby is. So right now the baby is about the size of a bell pepper, or it's probably a little bigger because we're closer to 19 weeks now, but for 18 weeks, size of a bell pepper. And we were looking at pictures of what this fetus likely looks like right now, and it's just the tiny skinny baby. Now it's pretty much completely fully formed, not ready to go yet. Viability isn't for a few more weeks yet, but it's looking much more like a baby, much less like an alien. I have been feeling very, very sick. Week 18 of my pregnancy, I have been very fatigued. I've been having terrible headaches, some nausea, some scent sensitivity that's causing my nausea as well. So those are some things that are going on for me. And I really hope that's encouraging to other ladies that might not lose their morning sickness after the first trimester. I know that I was so disappointed in my first pregnancy when I didn't feel better going into my second trimester, but just so you know, that's totally normal, and it's okay to still not be feeling well into your second trimester. And it's okay if you don't feel well your entire trimester, or any of your trimesters, if you're healthy. So if your healthcare provider sees some of your symptoms and has some concerns and wants you to manage them in some way, like I would definitely take that advice. But for me personally, it's all my symptoms are just the way I have pregnancies. There's nothing that's wrong with me. I don't have HG. I don't have, preeclampsia. There's nothing wrong with me other than I'm pregnant, and I just have tricky pregnancies that are kind of a pain in the butt. But what was really exciting about this week was, even though the baby has been moving around a lot for a long time, this week my husband was actually able to feel from just touching my belly the baby moving, and it like just moving like crazy, kicking my tummy. And I also want to reassure you that if that's not happening for you and you're about the same depth into your pregnancy as I am, that's totally okay. As I've mentioned in other videos, I feel my babies really early, and I can feel them on the exterior of my body very early as well, and other people can as well, which is different from a lot of individuals. It's because of the way the placenta is positioned, it's because of the way my uterus is shaped, it's because of my body type. There are lots of contributing factors as to why I feel my babies early and why you can feel my babies externally early. I have noticed, and maybe you can notice too, I'm getting those big pregnancy boobs. And I am still breastfeeding my son. We have a 19-month-old son. So I think that that's also making it so I have, increased bosoms, because my bosoms are still caring for our son, and then they're preparing for this new baby as well. So I'm running a little bit over time, but I'll quickly show you guys a belly shot. So I'm wearing a dress, so I'm not going to show you what it looks like underneath, but yeah, so that's what it looks like. If I kind of turn this way, maybe it looks like a little bit bigger, but yeah, it's not the really best angle. But yeah, so proportionate to my body, it's still a pretty small, insignificant. And I was like looking at it in the camera there just now, and it does look bigger in the camera than I think it looks in real life. I definitely don't have that, noticeably like, oh, she's pregnant look yet. So, but I really didn't have that with Oliver until the very end either. And last thing I want to say about that is, for other people who are pregnant, who are waiting for that baby bump and struggling with the way their body looks because they're retaining a lot of water in other places. Like, my arms get really thick while I'm pregnant. I feel like my under my ribs gets thicker and expands, which is a normal thing. Maybe you're carrying a lot of weight in your legs. I've noticed that I'm pretty hippy this pregnancy, likely because I had a baby already a couple years ago. So my hips have kind of reconfigured the way they sit. And you just look bloated. So I want to encourage you that if you're struggling with your body image while you're pregnant and you're just like, when am I going to look cute? And when am I going to just look like those other moms that just look like they have like a basketball underneath their tummy or underneath their shirt, and they don't really look pregnant at all except for that. Everyone holds their pregnancy weight differently in different places in their body. As crazy as that sounds, because we know where the baby's located. I joked a lot that I carried a lot of my baby weight in my face, and that's normal, and that's okay. And depending on what number pregnancy this is, depending on your pregnancy weight, and depending on your body type, your body is going to look different, and no two pregnancy bodies are going to look exactly the same. And so if you're feeling like, oh, I just look like I ate a few too many burritos, that's okay. It's beautiful, and your body is life-giving. So that's amazing. And just embrace all the crazy curves that your body's going to throw your way. So I am a little late on this video again, as I'm usually late on all videos, but I'm still technically 18 weeks today. So that's a really big way to go to me for getting this video kind of out on time. So hopefully next week, I'm going to try and do it midweek next week. So then again, you kind of get like a more accurate representation of what my body looks like in conjunction with the weeks. And then you'll kind of get like a more accurate just depiction instead of just me like saying in my memory, oh, this is how this week went. So thank you so much for tuning in, and thank you for staying, even though this video is a little long, and we'll see you next week. Bye-bye.